We're HomeTown Health, an organization that's dedicated to the survival of rural healthcare for over 20 years. Thanks for joining us, and let's take a quick look at who we are and what we do. Our vision is to support rural healthcare organizations in providing high-quality, accessible, and competitive care through this heavily regulated and increasingly technology-dependent environment. Our educational branch, known as HomeTown Health University, has a more specific vision to provide continuing education through various live and online formats, education that is high quality, current, effective, and applicable for its audience. Between these two visions, we strive to serve over 60 hospitals across the U.S., with that number ebbing and flowing through the participation of grant programs and state-specific opportunities, as well as our core membership here in the state of Georgia. Our goals as HomeTown Health is first and foremost to be a responsible advocate for rural hospital issues in government, business, and social arenas. Jimmy Lewis, our CEO, is our figurehead of this and is an active advocate in the Georgia State rural hospital discussion and is often quoted in news and other articles as one of the industry experts in the conditions and impacts of rural healthcare in today's society. Additionally, HomeTown Health has a goal of managing our collaborative efforts through grant programs. This can be SHIP programs or FLEX programs at a state-specific level, and we provide education and resources that are needed to comply with CMS mandates, industry changes, and just important needs that impact the financial stability of our members and our grant participating hospitals. Our goal is to provide value-added services. Each of our member hospitals have an annual fee to be a part of our membership, and we make sure that they get the value-added services that are equivalent or higher to what they submit in annual fees. This comes through a diverse range of services that we'll highlight today. Our next goal is to educate our essential vendors and our suppliers about the dilemma of rural hospitals and their unique needs when it comes to supply chain, when it comes to organizations, partnerships, and cooperative relationships. We feel the need to help vendors and organizations and business partners understand the unique challenges of our rural healthcare systems and how it impacts the way they do business and how to serve in those areas successfully. We also provide group discount opportunities and services that help cut the hospital operating costs and improve the bottom line results for long-term financial viability and survivability. We also have spent a great deal of our effort on the education side, and it crosses over into our member services to help provide revenue cycle improvement strategies and education services that help with payer reimbursement, compliant billing and coding, and maximizing financial stabilization efforts at each location. We also have a goal to be very visible in our field, and we aim to see each of our member hospitals at least once a year based on circumstances. Those may be through virtual encounters or face-to-face. We break our membership services down into 4 major categories. We have our business partner category, where we offer the cost-saving, service lines, and expert trainers. We also offer member education, on-sites and events, and communications. And we'll take a look at each of these service categories now. The first is our business partner network. Our business partners are not vendors. They are not organizations that just pay a fee and show up at our conference and we don't know anything about them and they don't know anything about our network. Instead, our business partners go through a rigorous application and vetting process. They have to prove that they understand and can function and succeed in the rural marketplace, and they are partners with a long-term commitment. They have to have a proven track record and best practice solutions that work within rural networks. And we offer a 3-strike you're out policy, which means if partners come into our network, they begin to work with our hospitals, and we run into any type of problem, then they have 3 strikes and then they are discontinued or retired out of our business partner program. The goal in this is to really help our hospitals by having partners that are trusted, that can come in and understand their unique position as a rural healthcare organization, their needs, and function in that scale. Often rural hospitals have unique financial considerations, patient volumes, the supply volumes are different than larger facilities, and so we want to make sure that our partners understand who they're working with and how to be successful in those markets. And it's a really great benefit for our hospitals because instead of having to start from scratch when they're looking to outsource a service line or need a provision of services, then they can come to us and we can provide them some recommendations to help them start that process off without having to start at the ground up. Our business partners are present at our annual live events to allow for face-to-face networking and are involved in many aspects of network support throughout the year. Our member education is currently very heavily around our webinar series, and then it will, of course, be addressed in our live conferences and events. Our monthly Medicare and Medicaid webinars offer industry-specific information on reimbursement, considerations, denials coding, and how to be successful billing Medicare, Medicare Advantage, and Medicaid. We also offer several quarterly series that focus on specific audiences and specific areas. So we offer a CFO webinars for our CFOs and our financial leadership teams. We have quarterly coding webinars through a partnership with one of our business partners, HCCS, who help us focus on what's happening in the world of coding, what are the updates and best practices, how do we maximize reimbursement through appropriate coding and documentation. We also offer a quarterly rural health clinic and provider-based clinic webinar series that focuses on the unique needs of those environments and what's unique to the clinic versus the hospital location or the skilled nursing location. What do we need to do about billing, quality, and other outcomes in clinic settings? Our other quarterly series is specific for critical access hospitals. It involves our reimbursement and strategy webinars, and based on the quarter, it focuses on a different area, including your financial reimbursement, such as payer-specific updates, as well as other quality and industry best practices for critical access hospitals. We also offer on-demand industry webinars as needed. So when something happens and we feel like our membership needs to know all together, then we have an on-demand webinar program that gets that education out and available. One of the things that is unique in rural healthcare and in a lot of healthcare, but especially in rural, is that many of our leaders and our staff in rural healthcare facilities operate over many jobs and they wear many hats. And so we brought member education online primarily to help hospital attendees and hospital education happen without having to leave their facilities so that they can continue to support their facility in day-to-day activities. In addition to our online webinar and training, we offer several live events every year. In the state of Georgia, we offer a CEO Day each January or February based on scheduling. When we are able to, we actually bring our hospital leadership up to the Capitol and they engage with their senators and their representatives. They are able to network with each other as well as people within the Capitol. They hear from speakers and chairmen of appropriations and other leaders in the Georgia government and have that opportunity to make their presence known and to put a face with rural healthcare there at the Capitol building. Annually, we host 2 conferences for our members and business partners. That is our spring conference and fall conference held in April and October. Those sessions include 2 days of breakout sessions, which often include grant-specific face-to-face training opportunities, as well as breakouts such as swing bed and revenue cycle management training. We also offer 1.5 days of main session training where we have all of our attendees together to hear from our presenters. We offer town hall, which is a very open forum, casual conversation where we talk about things that are happening, hear from different people in the industry, and hear from our hospital members as well. And of course, those are networking opportunities among peers and our business partners. Annually, each summer, we also offer a policymaker tour that is by invitation only, where our CEO, Jimmy Lewis, takes policymakers from around the state through a tour of several different hospital facilities over a few days to help them really walk through and see those hospital locations, meet those leaders, hear what's happening, and hear how things at the state level impact the local facility. In addition to our conferences, we do offer on-site visits. We like to be at our memberships at least twice a year. One of those may be virtual, one may be face-to-face. And we do support visits focused on strategic planning. We can help with community town halls. We also do revenue cycle department training or other specified education training based on our conversations with those hospitals. Our team is prepared to come in and work with any level of hospital leadership, whether that's a specific department all the way up to the CEO and the board. Additionally, we offer an Ask Our Experts opportunity for our membership, and that is where we can rely on our educational trainers, our industry experts, our business partners to help with answering questions that come from our membership, direct support for unique issues at locations, and just to get that information to our hospitals in an easy to digest informational format. And again, it cuts down on the need for the hospitals just to go out there and have to start from ground zero when they really need an answer quickly. Within the state of Georgia, we have been proud to work with the State Office of Rural Health, including the management of the SHIP and FLEX grant programs to support education and outcomes in rural facilities. We have also worked with the Department of Education for several years with a healthcare science program. Industry certification is its unique title, and it works to help push high school students towards healthcare. And it certifies their healthcare science program at their high school as a valuable pipeline for Georgia healthcare workers. Several members of our team also serve on committees, and we are proud to always have that moving opportunity. And so while you'll see a few of those listed here, it is not exclusive to those. And we are thankful to all of our state partners, the Department of Community Health, the State Office of Rural Health here in Georgia. We are also thankful to the Iowa Department of Public Health, who helps us in that state with the management of their SHIP program, as well as their FLEX financial and operational program. And a thanks to the state of Florida, where we are also able to work with their SHIP and FLEX funds on different opportunities and engagements. We do want to just remind you of our educational opportunities. You can take a look at our robust education at hthu.net. We offer over 600 accredited courses. We have over 1,500 courses online. We have more than 10 certifications or certificate programs, and that is growing by the day. And we offer a wide variety of CEU credits for healthcare learners. So we are an IACET accredited education provider, and that covers many boards and professional organizations, but we also work with other CEU providers to make sure that we've got CEUs for the various healthcare positions that are available. We encourage you to check out our online education and take advantage of a course online today. It's been my pleasure to meet with you today. If you have any questions for the HomeTown team, feel free to reach out. We look forward to serving you.